Good morning. My name is Anthony Hayes, and I'm the Vice President of Public Affairs and Policy at Gay Men's Health Crisis. We are the world's first and leading AIDS service organization, and we serve over 9,000 people living with and affected by HIV and AIDS in the New York City area. Thank you all for coming and joining us here today on National Blood Donor Day as we continue to call on the FDA to once and for all amend their discriminatory blood policy. This press conference has been on the books for weeks and weeks. As we all stand here today, we obviously are looking at this in the wake of what happened in Orlando, and we pause to think about what would be the best way to remember the lives that we lost, and we all agreed that in the wake of Orlando, we wanted to continue this. Orlando was an act of terror targeted specifically toward LGBT and Latino communities, and my heart goes out to all the victims' families, friends, and loved ones. I stood last night at the candlelight vigil at Stonewall Inn with thousands of New Yorkers, many whom are here today. We stood outside one of the most important gay right landmarks in American history to pay tribute to the 49 lives that we lost. We came together as a community to show the world that we will not be silenced. We will not be put back in the closet, even in the wake of a horrific attack. I'd like to take a moment of silence to honor and remember the lives that we lost in Orlando. Thank you. In the critical hours following the Orlando shooting, blood donors were in high demand. Local officials urged those in the area to donate blood to help the victims. But there was a group of people missing from the blood centers. They were unable to provide life-saving help to their own community, their fellow Americans, in a time of dire need. The LGBT community's blood was not missing because our community did not want to help. It was missing because our federal government still believes that gay and bisexual men are diseased despite the science that says differently. The current FDA policy requires that gay and bisexual men be celibate for 1 year, which is without question the same lifetime ban, just dressed up differently in hopes that we would not notice. This applies to all sexually active gay men, even if they are in monogamous gay marriages. Even though the FDA believes that gay men need to be celibate for 1 year for the blood supply to be safe, they do not have the same requirement for heterosexual people. Since the FDA seems confused, I want to say loud and clear today that HIV is not a gay disease. Heterosexual people can and do contract HIV in America. There is no shame in being HIV positive, and gratefully today, HIV is no longer a death sentence for most people. But as the CEO of GMHC, Kelsey Louis, has said in the past, the FDA's current blood donation policy ignores the modern science of HIV testing technology while perpetuating the stereotype that all gay and bisexual men are inherently dangerous. Blood donation policies should be based on science, not stigma. The United States government must stop reacting to HIV like it is the early 1980s. GMHC has been pushing along with many other organizations for years to change this policy so that in times of crisis like Orlando, we can accept all donations safely and inclusively. That is why we are here today to announce a medical advisory board that will meet later this year, which will bring together experts on blood donation policies, HIV, blood safety to discuss and debate a path forward from a 1-year celibacy ban to a policy that is based on the current science and not stigma. As you can see, one of the things that's missing here today is our friends from the FDA. We don't want the FDA to believe that our mission is adversarial. We want to partner with the FDA to bring these people together so that we can, once and for all, come up with a policy that will be inclusive and safe. I'm happy to tell everyone here today that later today in our nation's capital at 2:30, Congressman Quigley, along with many of his colleagues, will be joined to discuss a letter that he has sent to the FDA where he reminded them that the American Medical Association, the Advisory Committee on Blood and Tissue Safety and Availability, the American Association of Blood Banks, the American Red Cross, and American Blood Centers have all routinely called for scientifically sound policies applied consistently and fairly based on the donor risk level. We are grateful for our friends on the Hill, and in the coming days, we will be calling on all of the New York members to continue their fight along with us and join with their other legislator colleagues in DC to move forward on this policy. Additionally, we will continue our work with the Human Rights Campaign, Lambda Legal, FCB, whom are here today and you will hear from shortly, and the next gentleman that I would like to introduce. Please join me in welcoming Dr. Howard Grossman, who will unveil some details about the Medical Advisory Board. Dr. Grossman has the only private care practice dedicated to LGBT health and HIV care in New Jersey. He is a friend to many of us here and an expert when it comes to the science and health of blood donations. Dr. Grossman.
Thank you very much. Good morning. As was mentioned, I'm a physician actually here in New York City as well as in New Jersey, and I've been working in the field of HIV and LGBT health since the beginning of my career, which coincided with the beginning of the HIV epidemic. None of us, especially those of us in New York and listening to these sirens when we're standing here downtown, will ever forget the images of September 11th. One of those images that's burned into my soul was watching the first tower collapse from my apartment at 14th Street and 7th Avenue. Another was hours later in the days that followed, looking out my window at the long line of people standing to try to donate blood in front of St. Vincent's Hospital that snaked for blocks. In that line were hundreds and hundreds of gay men. Many were unaware of the blood ban, and others thought it would be lifted in this ultimate crisis. At first, many of those men were turned away. Later, we heard that overburdened healthcare workers, not wanting to deal with the anger and shock of those who were turned away when they were trying to help, just took their blood and threw it away. I don't know if this is true for sure, but I heard it from several people in the days that followed. This week, I've watched it all unfold again in Orlando as gay men tried to donate in the face of tragedy, only to be turned away, not for what they did sexually or for their other behaviors, but for who they had sex with. 1983, the year the FDA first suggested deferral of blood donations to certain groups, including gay men, was a year of fear and panic. AIDS was running rampant, and no one knew what was causing it 2 years after the first reports. There was no virus identified yet. There was no test. Numerous court cases have shown that the blood banking industry, out of a fear that people would stop donating blood, and for some that their profits would be threatened, had refused to make any changes or raise any alarm. That refusal led to the infection of many of those affected by hemophilia and others who received infected blood. The FDA had to step in. At the time of the ban, the government was only focused on the gay male community. Those of us on the front lines knew that the epidemic was spreading much further than that. At Kings County, where I was training, our patients were injection drug users and women and people who had immigrated from Haiti. At the time, the authorities were still actually arguing about whether women could get HIV. Well, AIDS at the time, we didn't know about HIV. As other groups were identified, however, there were no blanket bans proposed on whole groups. For heterosexuals, the ban was and is continued to be based on behavior, not identity. In 1992, the lifetime ban on any man who had had sex with a man since 1977 was instituted. And last year, that ban was changed to a ban that if you have sex with a man in the last year, you can't give blood. That continues to mean a lifetime ban. What's the science here? The FDA admits that current testing is much improved, pooled blood testing, which is the preferred method for ensuring the safety of the blood supply, could detect infected samples 9 days after exposure. The current fourth-generation HIV test detects 95% of infections within 28 days and 99.99% of infections in 3 months. So why not a 3-month ban? That would assume a policy motivated by science. Repeatedly over the last 30 years, and especially after 9/11, we've asked for studies to be done that would show how gay men could responsibly give blood. The FDA mentions this proposal again in its report last year, but it dismisses it as being too expensive. We've also asked for behavioral screening. They say that that would be too difficult on the people who are taking the blood, and they're afraid to ask questions about people's sex lives. The truth of the matter is that our government and our medical establishment marginalizes gay men. First of all, we're seen as a small group. The FDA cites 2%, 4%, 7%. We're obviously too small a group to matter. The truth of the matter, and most importantly though, is that the FDA, the government, and most of the medical establishment views us not as people but as disease vectors. The FDA report suggests that gay men are 135 times more likely to be infected than heterosexuals. Where does this number come from? As far as I can see, it comes from the risk calculation that they publish that says that receptive anal sex with someone who is HIV positive carries a risk that's 135 chances out of 10,000 encounters for becoming positive. What about people who never have anal sex? What about gay men who never have receptive anal sex? They give no answer to that at all. What about those of us in our monogamous relationships, as was mentioned? The FDA cites research that says that 25% of people engage in extramarital affairs, but that research was not done in gay men. It was done in heterosexuals, and it's one paper. There's no research on gay men, so a bunch of lying, cheating heterosexual men, because of them, were banned from giving blood. The FDA report even says, what if we end the ban now? What about the next disease that's introduced into the gay community? Disease vectors. Well, what was the next threat introduced? Zika virus. But who's the vector here? Heterosexuals and, most importantly, pregnant women. Do you see a call to ban blood donations from all those who've traveled to Puerto Rico or the U.S. Virgin Islands or Brazil? No, you don't. And HIV infection is spreading most widely in the U.S. South. Have we seen a call to ban blood donations from Georgia, Mississippi, and Florida? No. And why not? Because we judge heterosexuals on their actual risky behavior. We don't marginalize or pathologize heterosexuals as a group. Why not do the research? I'll tell you why. Because the FDA is afraid. They're not really afraid of what will happen to the blood supply. They're afraid that if they study the issue or make any real substantive science-based and behavior-based change to the blood policy, they will stir up that angry hornet's nest of homophobic, racist, anti-science bigots that sits up on Capitol Hill. And those people are looking for every reason to cut their funding anyway. Follow the money, people. That's the real reason we're not seeing change. I grew up at a time when donating blood was seen as one of the prime acts of responsible citizenship along with voting. Everyone gave blood in those days. The HIV epidemic and our government's response to it have denied me my right to contribute out of fear and bigotry. I demand my rights now. Thank you.
Wow, how does one follow that? Hi, my name is Joseph Barbagallo, and I'm an internist and medical strategist at FCB Health, who is partnering with the GMHC in regards to the upcoming advisory board that we have. The upcoming advisory board that's planned will bring together a group of multidisciplinary experts to really take a discerning look and reevaluate the present policy around blood donation for gay and bisexual men. As you just heard from Dr. Grossman, this is not a perfect science and it's not an easy science, but it's one that can definitely be better. I'm very happy to announce that in addition to Dr. Grossman, who you just had the pleasure of hearing from, there are a number of other experts who have committed to be participants in this advisory board. Dr. Dimitri Daskalakis with the New York City Department of Health, Bureau of HIV/AIDS Prevention and Control. Deborah Kessler, Director of the Special Donor Service of the New York Blood Center, and who led the Donor History Questionnaire Task Force. And Dr. Walter Lazewski, an expert in transfusion medicine at the Tulane University School of Medicine. Again, our Blood Equality Initiative takes the stance of science informing decisions, not stigma. I'd like now to introduce Nithya Das, Senior Vice President and General Counsel at AppNexus.
Good morning. I'm Nithya Das, Senior Vice President and General Counsel at AppNexus, one of the largest private technology companies headquartered here in New York City. I'm here today as co-chairperson of our company's Committee on Diversity and Inclusiveness. Last month, after a great deal of thought and reflection, we made a decision, together in consultation with AppNexus, our company's LGBT employee affinity group, to cancel our annual blood drive held at our New York City headquarters. This was a difficult decision. AppNexus is deeply committed to ensuring that we have an increasing and secured blood supply. However, we're also deeply committed to making sure that we maintain and foster a culture of diversity and inclusiveness for all of our employees. Blood banks are a critical foundation of our public health infrastructure. According to the American Red Cross, there's an individual in the United States that's in need of blood almost every 2 seconds. One donation has the ability to save up to 3 lives. Not just those who are injured, but those who are suffering from cancer, sickle cell diseases, or other life-threatening illnesses. Given how critical blood banks are, we should all have a combined commitment to ensure that we're increasing and safeguarding the blood supply. Unfortunately, the current ban on men who have had sex with other men works against both of these goals. By excluding an entire group rather than screening by behavioral risk, we're banning millions of donors from giving blood without actually contributing to a safer and more secure blood supply. To prevent a man from donating because he's had sex with his partner or his husband is neither an effective way of identifying a high-risk individual, nor is it necessary in light of the universal blood testing measures currently in place. This was a difficult decision for AppNexus, and as highlighted by the events of this last weekend, blood donation is critically important. But ultimately, we could not sanction and sponsor an event that would stigmatize some of our employees, particularly in service of a policy that works against our common goal of increasing and safeguarding our blood supply. AppNexus remains committed to help achieve both of these goals, increasing the blood supply and safeguarding it, in partnership with great organizations like GMHC. We also intend to begin contacting peer companies in New York and elsewhere to enlist their support for a petition that asks the FDA respectfully to reconsider its policy and to issue guidelines that will truly expand and safeguard our blood supply. Today's announcement is an exciting one and an important opportunity to broaden the dialogue in a constructive fashion so that everyone who is able to give blood has an opportunity to help. AppNexus looks forward to continuing to work with organizations like GMHC to make this happen, while also ensuring that we're fostering a diverse and inclusive environment for all. Thank you. Next, I'd like to introduce Gilles Herrada, who's an individual who's had direct experience with this issue.
Hi, I'm Gilles Herrada. I'm a research scientist and a book author, and I was asked to give a short contribution to today's rally. There are times when a community must face a difficult truth and adjust its behavior accordingly. At a time when the AIDS epidemic was crushing countless lives, the gay community adjusted its behavior accordingly, responsibly and courageously. Thanks to the recent success in medical research, the context is very different today. There is no longer any objective basis that can justify discriminating against gay and bisexual men and demand from them, and only from them, that they be celibate for 1 year in order to donate blood. In the wake of the Orlando massacre, gay and bisexual men find themselves banned from donating blood to save the lives of their brothers and sisters, just as they were banned from visiting their friends and lovers at the hospital or from attending their funerals just 30 years ago. People need dignity just as much as they need food and shelter. And when it comes to its own dignity, the gay community has fought very hard to earn each and every bit of it for decades, if not centuries. I am free to love another man today because previous generations of gays and lesbians have fought courageously and uncompromisingly. Despite our recent victories on the front of equality, we will not settle for less than full equality. We will not settle for less than true dignity. And I intend to be just as uncompromising today so that the next generations, my spiritual children, experience the sense of dignity that every human being deserves.
So before we open it up to questions, I would like to recognize members of United States Senator Kirsten Gillibrand's office is here with us today, City Comptroller Scott Stringer, New York City Public Advocate Letitia James, as well as Council Member Daniel Jones. And with that, we're happy to take any questions that anybody has.
What do you think it's going to take to convince the FDA to revisit this policy and change it?
I think that what we've seen, Gay Men's Health Crisis has been fighting to have this changed for years and years. I think that what we are painfully seeing out of Orlando is a horrific example of why we're fighting for this, of why we've been demanding for it. I think if the FDA can't, in the wake of Orlando, have a real gathering of scientists, experts from the community to do that, then to be honest with you, I don't know if the FDA will ever revisit it. And the reality is, Gay Men's Health Crisis has been calling on Secretary Burwell since the new policy of 1 year celibacy requirement has been announced to have a more open, transparent process, because that is one of the things that was most well received during the HIV and AIDS crisis. It was the activists who demanded the government respond, and that's what you're seeing here today. And I think that when the men and women who went to donate blood, which is a community response, the fact that people were left out in Orlando simply because they're gay is unacceptable, and it's egregious. And Secretary Burwell and the FDA need to take action. Other questions? Dr. Grossman?
Truthfully, I'm standing here angry about the FDA policy, but I'm not angry at the people at the FDA. I mean, I do think we are in a place in this country of anti-science and bigotry, and the threat to our government organizations, our government bureaucracies that actually work. The FDA is an incredibly effective organization, and the people that work there are very dedicated. But their hands are tied in many ways because of what they know will happen if they actually do something. Let's face it, the FDA, the CDC are not allowed to study gun violence. They're not allowed to study the effect of guns. They're not allowed in many cases to study gay men. And until that's changed, I think they need us to have their backs as well in order to change that. The science needs to be done. The science, I think, of actually giving blood. I mean, truthfully, if they wanted volunteers to say, screen the blood by behavior, test people for HIV infection and let them give blood if they're HIV negative, I would take that blood if they wanted me to do that study. And I think a lot of other gay men would as well.
Other questions? Okay, with no other questions, I want to thank the members of the media for coming, as well as our participants behind me. And anybody who would like to speak to any of the speakers, we're happy to be here and take more questions. Thank you so much. Oh, one last thing. So we have planned a number of things today, and artist Jordan Eagles is here, and we have prepared. He has prepared an installation on the High Line tonight to demonstrate through art how this blood ban is limiting gay men, and to really sort of continue this conversation. So we hope everyone will join us tonight on the High Line at 8 p.m. Thank you.